Well, we have a quorum, and it's past the witching hour, so call the meeting to order. Approval of the minutes, which you all received. Any additions or corrections?
I do not. I'll make a motion to approve.
Is there a second?
Second.
All in favor?
Aye.
Opposed? Minutes are approved. So, at this point, we're health officer. Do you have anything to report?
Yes, we are changing minute by minute. So some of the documents I actually received minutes before I came over here. So unfortunately, you don't have them with you, and I had some technical difficulties where I'm not able to broadcast onto the screen. But for one's the contract. It's been drafted by Chris and Ron, our county's attorneys, and it's on its second version. We sent out a first version to Dr. Bales. She had some amendments she wanted in there, so the attorneys made those amendments. I'm waiting for her approval on those amendments, but I believe she'll accept it because everything was agreed to. So on top of that, she asked for insurance, malpractice insurance, which is standard. So I was waiting on a quote from that. I received that this morning before coming over here as well, and I believe it will meet her terms as well. I showed her a copy of Dr. Jetmore's terms and balances and deductibles and premiums, and she was comfortable with those, and this mirrors those numbers. That is for a year policy, and that is through Lions Insurance Company, which is who handles the county's insurance for everything else. It would total $5,483.75, which is actually about $2,500 cheaper than Dr. Jetmore's is. And that would include any director type admin services she would provide, and it also includes direct patient care if she chose to do so. The contract itself, there was terms in there for separation. Each party would have to give so many days, 60 days of separation notice, things like that, that we would cover her malpractice insurance, that she would maintain her licensing requirements for the state of Indiana and all that, and that we would provide her with the insurance, and that we provide her with the $40,000 a year salary that we agreed to months ago. I can pass this out if you guys want to read it. But what I'm asking the board today is to essentially approve this contract contingent on Dr. Bell's approval. That way we can move it through to the commissioners tomorrow, as long as I hear from Dr. Bell's today. Do you guys want a copy of this to read?
I've reviewed it and read it.
Yeah.
Actually, I agree with what you did and actually recommended a couple others. But what it really comes down to is that the state statute really spells out the appointment and this reasons for dismissing the health officer. And so we're held by state statute, and then so the contract basically just included the state statute. It has the duties, and it has responsibilities, and it has and it's interesting, under the statute, you cannot dismiss a health officer without cause. It has to be with good cause. And they spell out what those are. So that even brought up the point, do you even need a contract? Because it's an appointed position where the duties are spelled out. Everything that you would usually put in a contract is spelled out in the statute. But basically, because of the salary or the stipend and the insurance part and notice, I felt that it was prudent to go on and have a contract. So I reviewed it today and was happy with it. I'd be happy if anybody wants to look at it, but we will need, if you're satisfied, a motion to.
It's a 4-page contract.
And it was sent in the email, correct?
Not this one, I just
Not
got
that
it back,
one. Okay,
yeah.
okay.
The Virgins one was the one sent in the email to
Okay.
everyone. Yeah. This is Dr. Bell's potential contract. So the first section goes over the employment, and it says essentially that she would accept employment and serve as the health officer with all the duties, powers, and authorities provided by law in IC 16-20-1. That's what Dr. Ryder was referring to, all the statutory requirements that are provided for a health officer. And then subsection 2 is the term of her assignment, and that's a 4-year term as any other health officer in the state of Indiana. The third section is compensation, stating that we would pay her $40,000 a year. The fourth one is the benefits that we would provide, the liability insurance and TEL insurance. TEL insurance is insurance that is provided to that physician after they leave employment or the contract ends to cover them for anything that happened while they were employed or contracted. Subsection B of that particular section was travel and training, that we agreed as a health department to reimburse her for any travel or training that we required or requested. Number 5 is the licensing requirements. As a condition of employment, she must remain licensed as a physician. And policies and procedures, that she would be bound by Wayne County Health Department's policies and procedures as they may be from time to time adopted, modified, or amended in the future. And then 7 is the termination. An employer may terminate this agreement only as provided by law in that same IC code 16-20-128. Failure to perform the officer's statutory duties, failure to enforce the rules of the State Department of Health, or other good cause. You always get that gray one in there in a statute. But except as provided in the statutes listed, the health officer may be removed only by the board that appointed the health officer when a removal of a local health officer is sought by the appointing authority. The local health officer is entitled to the following: at least a minimum of 5 days' notice, open hearing, and representation by counsel. If she chooses to resign, this is on her terms, she would give us a 60-day notice. That's subsection 8. Really, that's it. Now that's Ron here. Ron, did you review Dr. Bell's contract that Chris drafted?
I did, but I'm not sure I saw the last draft, because I didn't realize he wasn't going to be here today.
Okay. He removed the subsections that she requested and added in there that we would provide TEL insurance if she left on her own terms, or but if she left without or with cause, if we had to terminate her for cause, then she would be obligated to pay her own TEL insurance.
Well, we want to look at that situation, because I think there's could be vicarious liability if we were her employer. And so it may behoove us to make sure there's TEL in place, but we can deal with that.
Right. Are there any questions about Dr. Bell's contract? It's really relatively short and simple contract for employment.
Compared to what we've had, it's quite
yeah, I guess, compared to what we've had in the past. But like I said, Dr. Bell's looked over it the first time. She only had a couple amendments, and those were made. Dr. Ryder's seen it.
Any further questions? I'd entertain a motion.
Motion to approve contract for employment.
Subsequent clarification.
Contingent on Dr. Bell's.
Contingent on her
Yeah.
agreement, of course.
Yeah.
Second.
All in favor? Aye. Opposed?
Okay, so we'll move on into Health First Indiana updates. The partners have started to invoice and report data. That's a good thing. I did send you a copy in that packet. What page it's on? It's on page 13 of the packet, towards the back. These are some of the numbers that, as I get reports in from our partners, I have to put them into a database for the State Department of Health, and they take that and obviously compile these numbers. This was sent to me last week. This is what we have inputted so far in Wayne County between us as the health department providing services and our partners providing services. And these numbers are essentially 6 months. I didn't start getting data and putting them in until late July, and I asked them to backtrack to June, so some of the numbers aren't. From August on, they're pretty accurate. So I would assume our numbers are actually larger than what's listed on this document. Moving ahead with Health First Indiana, we as a county health department need to narrow down 3 key performance indicators and core services for the State Department of Health. And I have to have this into the state the first week of November. So the 7 core services of focus here in Wayne County are on page 2 there of your packet. And it's maternal and infant health, trauma and injury prevention, lead and healthy homes, tobacco prevention and cessation, chronic disease prevention, obesity in particular, and chronic disease prevention and reduction, cardiovascular disease, diabetes, and then HIV, Hep C, and syphilis testing and treatment. So we have to narrow down 3 of what's most important to us here in Wayne County out of the 7, and then really focus down on those 3 and provide basically what we're going to do for those 3s, which is what is listed on the next page, page 3. This is a document the State Department of Health uses, and I'm sure most of us have heard of what we call SMART goals, and that this is a breakdown of the SMART goals basically. Once we pick that KPI, this is how we break it down. So this is more of an informational thing. If anyone has a particular area that they're passionate about, they're more than welcome to email me and stuff, and we'll kind of do a small survey or vote or whatever. But I think one that we definitely have to work on is maternal and infant health. That's definitely, I think, a high priority for Wayne County.
Yep.
Trauma and injury preventions, our numbers are pretty high, but I think we have other agencies out there also working on that as far as the PACE Center goes and things like that. Chronic disease and prevention when it comes to the reduction of cardiovascular, diabetes, HIV, Hep C, I think those are another key focus for Wayne County. And then tobacco cessation and obesity obviously are issues too. Those are issues across the country. So we'll obviously focus on those as well. But I think those are the 3, but I'm also going to get with our medical staff think what their opinions are. But maternal and child infant health, I think that's going to be on there no matter what. I think the other 2 are going to be subject to change.
And what's the duration that you have to, is it something you do every year?
So what they want is us to focus down on those 3 KPIs, provide the data as far as our SMART goals go, and we have to come up with a thing. So if it's maternal and child health or infant health, we're going to have to say we're going to reduce the number of XYZ by 2% by the end of 2025. It's basically our goal. And then as we take all these numbers in over the next 14 months, they would produce a sheet like you've seen on page 13 there of our numbers and percentages and tell us whether our SMART goal or KPIs are actually working.
Okay, but the duration to accomplish that, they want you to take
I have
yearly or 2 years or what?
basically from the year of 25. So I'm submitting the goal in November, it's getting documented, and the program
So that'd be
starts.
a goal for 25.
Correct, it starts in 25 and then ends at the end of 25.
So because of the funding in terms of how is that?
Correct, because the Health First Indiana was from 24 to 25.
Okay.
And then if they continue with it, then we'll probably have to restate our goals.
Correct, so there's mixed emotions on that, mixed comments I'm getting from the state and other agencies as far as Health First Indiana. Whether it's going to be in the same capacity that we have it now is unknown. Tax revenue in Indiana's went down. We had a meeting with the Lieutenant Governor last week, and she explained the tax revenue's going down, not specific to Health First Indiana, but just overall the state itself. So the revenue may not be there like it is this round, but it's hard to put the toothpaste back in the bottle once it's out. So I believe there's going to be some kind of funding there. It just may not be called Health First Indiana. They're not going to tell all 92 counties that they now have to lay off people. I mean, I just don't see that happening. So I think it will continue, and once we get that goal set and we complete that goal by the end of 25, I think we'll be able to do it again in 26.
Okay, so you have to make these by November.
I think November 2nd or 3rd is my deadline. And it doesn't have to be in great detail. They just want to know what the three that we're going to mainly focus on.
Other than maternal and infant health, any others that any of you feel rise to the top?
It says here, local health departments falling within the bottom 10 counties for an indicator should develop a KPI for that indicator. So I know that, are we low on maternal and infant health?
Yes.
And the other thing I wondered too, HIV, HCV, syphilis, is that an area that we need to be focusing on?
We're not in the
But
bottom
it's-
10, but
Okay.
we're pretty close. The trauma and injury prevention, we do have a fall or a high rate of injury in Wayne
Mhm.
County. You know, and that could be
Mhm.
anything, any type of injury, basically. But we have other agencies
Right.
working on these
Right.
KPIs too.
Yes.
These are
Okay.
more for us as a health department, not what our partners are already doing
Yeah.
for us.
Okay.
So will you notify us before you send them in of what you picked? So you
Yeah,
get some
absolutely.
feedback on
Yeah.
Mhm.
email?
Dan, do you know how we stand on smoking cessation and smoking?
As far as what programs are out there, or
Relative,
percentages?
county ranking relative.
I don't know the overall ranking number. We're kind of mid-pack in that when it comes to the state of Indiana. And then we have a meeting on the 22nd with Centersona Community Partner to cover a potential partnership in paramedicine. And that is a program that would allow, if it's not law enforcement or fire or EMS, non-emergent, this would allow them to go to that individual's home and provide them services or referrals or treatment or whatever the case be. It's needed in Wayne County. All right, we'll move on to the money part of the business, I guess. We had 5 grants that were in the negative, and I was able to move money around from our COVID reimbursement fund, and that fund, it wasn't a grant, it was a fund for every COVID vaccine that we administered. We got an admin fee from the state. That program ended, but we had a positive balance of $145,000. I got approval from the state to use that money, but we took that money and added it to all of our negative grants that were already done or no longer operable, and we brought those back to a zero balance, so we're able to close them out. So that's a good thing. So we're now able to move forward. The only funds that we have active now are the ones that are truly active. We don't have anything sitting in the and a negative from years past.
And that's good, but I think we also ought to acknowledge the help that Kathy Williams has
Oh,
given
absolutely,
since she
yes.
was here.
Yes.
This is kind of a cause she undertook.
Yeah, thank you, Kathy. We do appreciate that. I apologize. We have installed SoftWorks on our system. That's the software that the board and the commissioners approved probably a month or two ago. It integrates with WOW, our financial software for the county, and that is up and running, and there's some hiccups, to say the least, right now, so we're working that out with SoftWorks. And I just wanted to bring it to the board's attention. Again, we went over this, I believe, a couple of months ago, and the board approved it, but it was cabinet funding for our birth and death section. I don't know if you guys remember that or not, but the quote we received was for $14,000. I took it to the commissioners the following day, and they asked me to retrieve a second quote. And that's a very hard thing to do in this particular cabinetry, but I was able to get a second vote, or a quote, and it was about $9,000, so it was $5,000 cheaper. So what I've done is I've redone both quotes, and the cabinets that we want or need, the clerk's office has, and they're approved, and they come in already built. I was able to get those down to $9,575 from the $14,000. So, and that will fit our needs, and that cabinetry will all fit within the fire retardant room, and protect those books. Like I said, we spend $2,000 a year in rebinding on these books, so it will pay off in about 5 years time. So if the board is okay with that, then I'll go ahead and move forward with the commissioners tomorrow and ask for approval of that, those second quotes, since it is $5,000 cheaper.
Is there a motion to amend our
Less money's always good.
funding to the lower fund amount?
I'll make a motion.
Okay.
I'll second.
Okay. Further discussion? All in favor? Aye. Okay. Opposed?
Well done.
Yeah.
All right, we'll move on to staffing updates. So we filled our part-time clerk position. Stephanie Campbell is the new employee. This is a position that handles all of our food permits, takes in all the applications and issues our food permits. She also provides any breaks for our registrars to issue birth and death certificates, and she covers vacation times for those two employees as well. It's a position that operates 20 hours a week from 10 a.m. to 2 p.m. And so far she's doing really well. We was able to fill all 3 medical assistant positions that was approved. Gennaro Sparks was one of them, Sarah Gurton, and Wendy Whitlow. Those are our 3 new medical assistants for the health department. Gennaro has been here under the independent contractor thing for a while, so we was able to get him moved into that county position. We have 1 independent contractor left over, and if the Virgin's contract gets approved, she'll be employed by Virgin's and no longer independent. We do have an interested nurse practitioner here in Wayne County that is interested in filling the role that is void right now. I did have a conversation with her and told her that at this point I think we're more comfortable with going through Virgin's than an independent contract. And she has agreed to that and has already applied to Virgin's, and if everything gets approved, we'll have an interview with her with Dr. Bells and Dr. Ryder and any board member that wants to be present during that time. I don't want to say her name just in case, not in a public meeting. So, and the next thing is the Virgin's contract. This is a contract that has went through 8 renditions, and we are finally to the end here. I believe Ron and Chris both approved the final version.
Chris ran it by me kind of verbally, the loose ends we had, and I'd already seen it, so I think it's more a matter of appeasing them and their counsel.
Right. So, and Virgin's agreed to the final draft as well. So both sides of both parties have agreed to this final draft. So this was the one that I emailed to you last week. So I'd ask the board to approve this contract, and we can move forward with a hiring agency called Virgin's.
Questions? Comments?
would say this is going to be very much appreciated by the commissioners. The historical pattern of independent contractor employees, which is a legal non sequitur, has always been bothersome, so this cleans it up. It's good.
I think this makes it easier for everyone involved, even the employees themselves. I think this is peace of mind at least.
I entertain a motion to approve.
So moved.
Second?
Any further discussion? All in favor?
Aye.
Opposed?
And then we'll move into program updates. We have teamed up with a company called Aspen. They are navigators for insurance. And they have agreed to, with the permission of Centerstone, I called Centerstone, retrieved their permission first, to set up at our Meadow Exchange program and try to navigate some of the clients into having insurance or better insurance or whatever the case is. So they are set up to start that this coming Tuesday. Today, yep. So Aspen should be there right now. And they're also going to, they would attend not only the exchange program, but they would attend anything that we asked them to if they had availability to do so.
And what's the term of that contract, or is it just,
For Aspen,
yes?
there's no contract.
It's just a relationship?
Yeah, it's just a relationship, a partnership. Yeah. We've hosted several clinics over the last month. We did Vail School, Star School, Northeastern School, had a clinic at Elstro Plaza for the schools, Golay Center for the schools. We conducted one at Willows Nursing Home. We did vaccine education at Safety Village. And we did 2 different clinics at Earlham, one for the students, one for the staff, and we also did one at Fairview Elementary School. This is not including the weekend, normal first Saturday of the month, Monday night clinics in the Hagerstown and Cambridge City clinics that we operate. We also attended some other off-site community events. We did the Reed Challenge Day. We were present for that, and we was also present for the Walk Out of Darkness event this past weekend. Moving to miscellaneous, the environmental staff went to fall conference, and at fall conference, this is when they introduce or explain, educate new legislation, code changes, etc. at the fall conference. It's kind of like any other conference. So they all come back with some good information. Probably the only thing pertinent to everybody across the board, I guess, is a new food code. So there will be a new food code most likely next year, and it's going to mirror FDA food code, and that's going to force us into changing all of our forms to be compliant with the new code. So I may be coming to you next year for permission to spend some money on forms. And that is, they're trying to get this across the board, across the country. And they're trying to just, everybody go to the FDA code so we're not operating with 50 different food codes. Angela Dawson, our registrar, that issues birth and death, she went to her fall conference for vital records, and she was able to network with other departments and learn of some new changes that are coming. One of those is Drive, and if you guys read the KPIs and stuff from the beginning from Health First Indiana, it says on there that we should be able to issue a birth or death certificate from the system Drive. That is a state-operated system, and it is not functional yet. Nor do they know when it will be functional. So there's no one that's going to be compliant with that. But what that does is, once it is functional, you'd be able to go to any county in Indiana and retrieve your birth or death. You couldn't retrieve your death certificate, somebody else could. And so if I'm Henry County and I'm born here in Wayne County, I can go to Henry County, or I can go to Allen County. So it will be beneficial once it's in place. Crow shredding. We have a shredder that is going out, and to replace that shredder is going to cost us about $800 to $1,000. So we've looked into crow shredding. There's no contract. There's no anything like that. It's a 1 monthly fee. I think I put that in your packet. I think. No.
It's towards the back. It's just a
Yeah. Should be the last page of the packet.
Oh, it's in the very back.
So one secure collection. Every 28 days is $55, so once a month, $55. If we had 2 tubs, basically they kind of look like the city rosy rollers that they put out. If we had 2 of them, it's $60 per service. They would give us a certificate of destruction provided upon completion of each service. And there's no, what's that?
They shred on site.
Yeah, they shred on site. And there's no term contract needed. They'll earn our business from service to service. So we will probably be transitioning from hand shredding over to crow shredding.
Say monthly?
Monthly.
And then not purchasing a shredder then.
Correct, not
Right.
repurchasing a shredder. We'll move on to the environmental side. There's nothing to report in housing, food. I did mention the new code that may be coming down the pipeline. We're starting to gear up for the 2025 permits. We have approximately 430 food establishments in Wayne County, and that goes from everything from a gas station up to Applebee's or Chili's or one of the big chain restaurants. So we send out reminders November 1st, and the establishments have until the end of business on January 31st to pay their permit fee. If they do not pay it before that deadline, their permit fee triples per the ordinance. So we're giving them 4 months. I give them November 1st to present time, and then once we start hitting the first week of January and I don't see anything happening, I send a list to the inspectors, and the inspectors start calling the establishments. So we make several attempts to remind the business owners. We finished up 2024 festivals and fairs, kind of. Usually 4th Street Fair is the last one, but we have the haunted place out on 121 going toward Forsaken Forest is what it is called. They're going to be operating food trucks over a period of 4 weeks on each weekend event, so we still are inspecting those events every weekend right now. As far as the lead department, we did send our XRF out for resourcing. The board approved that a couple months ago as well. It was a $9,000 resource, something we have to do. When the radiation starts to decay, we have to resource it and get it back up to par. So that should be coming back to us soon. And the well water program that I introduced last board meeting, we are going to start that on the 28th of this month. So it's been posted on our Facebook page. It's posted on our walls, doors there at the health department to let people know. I sent an email out to the Realtors Association. That way they can get it out to their network of people. I'm hoping Mike writes something about it in the paper so we can get a little advertisement there. And this will fill that void in our community as far as third-party well testing when it comes to people trying to buy homes or refinance homes. There's not any agencies out there that will do this third party for these individuals or banks. So this will fill a void in that department in our county. And I believe that is all I have. Is there any questions for me?
I will mention that measles is making a comeback in this country.
Measles.
And I think it's because immunization rates have dropped. And it's a wintertime disease, basically. So they think they may be seeing more measles, particularly in areas where they drop below the herd immunity. And most of the measles cases have been brought in to people who've gone overseas and picked up measles while they were abroad and then coming back with it. I think it was in the year 2000, we didn't have any measles, but now measles is making a comeback, and they fear that it's going to get worse because of more reluctance for people to get immunized.
Have we started with the syringes and telling people how many, and how's that going?
So far, nobody's come back said they had any problems so far. I'm sure they're getting a little, feedback there at the program itself, but
That's been implemented so far already.
Yeah, it's been
Right.
implemented now for 2 to 3 weeks. It was a week after the board approved it that I put it into
Okay.
place, and I've had no complaints as far as telephone in office. Our employees haven't said there's been any issues at the
the
counter,
site,
so.
okay.
Returning them in an actual container instead of.
Still working on that, yeah.
Yeah, that's, I'm sure that's gonna be a
Yeah.
challenge.
Yeah, we're still working on that. What we do have, not necessarily a problem with, but we get calls from dispatch. So if someone finds a syringe on the ground during business hours, we don't go after hours or on weekends, but during business hours, we'll go out and pick those up. So we did get a call last week from another, I'll call it an agency here in Richmond, Wayne County, that they found needles in like a well that was almost 15 foot down below ground that you had to crawl down a ladder to go get. And they asked us to go get that, and I told them no, I'm not going to put my staff in danger of climbing down a ladder. That's not part of what we agreed to. So they were upset with that and said they were going to complain. I've not heard anything so far, but you know, we're not climbing down ladders or into dumpsters on roofs or unsteady.
Is it a well
things.
that's not in?
So Elstro Park, it's a sewage well or something around
Okay.
Elstro Park, and
Okay.
you have to literally climb down a ladder to get down to it. So it may be covered with like a grate or something, so the public's not, dropping that into it. And they're probably just tossing them down that grate. But
Right.
I'm not sending people down there to get it.
Dan, is there any sense of how COVID is, and maybe you covered it earlier, but the rate of COVID infection and
We haven't seen a large increase as far as the numbers go from what we're getting back from the state right now. It's definitely around. People are testing positive.
we had 3 in our office.
Yeah, and I don't think we'll ever get accurate numbers because there's just not as many tests happening now.
Right.
And everybody's
Right.
wanting to, test from home and then they don't share the results. So it could be a lot larger than what it is, but as far as the numbers reporting to us are not, they're normal, if that's what you want to call them. But
Are we still doing wastewater?
as far as I know, we're sending them off for
So
wastewater.
that would be interesting to get the wastewater report to kind of tell us,
Okay.
Yeah,
give us some idea of what's going through.
yeah, it's probably the most accurate way, actually. I mean, that's.
Can we get wastewater reports from them?
Yeah, I'll have to email the state and ask them.
That might be something worth reporting on, is just our wastewater
Write that down.
report, what they're finding.
Yeah, we had one of our staff members test positive last week.
Yeah.
Too.
My wife and I did.
Yeah.
Yeah.
3 weeks ago.
Yeah. There's some nasty stuff going around for sure.
But we are out of test kits at the health department. We gave our last batch to, I believe Earlham or Ivy Tech was one of the local universities here in town. So we don't have any more that we can give to the public. And we don't have the funds to purchase tests in bulk right now. Any other questions?
Oh, I did have a little bit of feedback. So there was a request for xylazine test strips. And that was I believe that came from the syringe support program. I looked into it, so I make sure to supply Narcan and fentanyl test strips. But when I went to the Overdose Lifeline site to try to order, they are not available, and I was informed that they don't have a consistent funding source for xylazine test strips. So they're not able to provide that for. So I just wanted to share
So
that.
that's just something we can't do.
We cannot do it currently because there's no funding mechanism for them, so.
And I've been in conversation, very short conversation, but with the sheriff, and they were going to provide us test strips for our syringes. So every 50 syringes we may pop the plunger out, stick the test strip in, and we can, really doesn't do anything other than provide us data.
Yeah.
To kind of show us what's coming in through the syringes and
Right.
stuff. So
And then
we'll,
isn't there a plan to send out a certain amount of them, the syringes that you
to
return?
IDOH, yes.
Yes,
Yeah,
okay.
through the lab.
Yeah. But that's kind of, that takes a while for stuff.
That was also with the sheriff's department. They have a machine over there evidently that can
Mhm.
detect, drugs.
Mhm.
So they was kind of using that program as a calibration, to see how
Mhm.
accurate, the machine was.
Mhm.
That never ran off. I mean, that never started because that happened probably 6 months ago and it just never
Mhm.
got off the ground yet. But the testing, the plungers with the test strips, the sheriff and chief deputy said they could give us 10 or 15 a week, no charge,
Okay.
it was easy to do.
And with Virgins, once that's approved, how quick can the nurse practitioner be interviewed and then start? So that funding source will come back.
So the nurse practitioner that I was in conversation with today, I think she would essentially have to give a 2-week notice to her current employer. And then at that point, I'd have to call Virgins and ask them, because she's already applied. I would hope within that 2 weeks that she gives to her employer, in past conversations with Virgins, they're telling me if there's somebody there, they can have them to us just that fast. So with her already applying, she applied over 2 weeks ago, so they should be well into the background phase and all that good
Mhm.
stuff, for her if she chooses to move forward, and Dr. Ryder and Bell's,
Do we get some kind of concession on the fee when we're the referral source?
concession on what?
Their Virgin's fee when we're the referral source? I thought I saw that.
The other company had a concession on that
What version is
if
the
we
contract?
referred
Right.
them, so
Maybe
they
that's
didn't
what
have to
I'm thinking about.
recruit, but Virgin's is flat 35% no matter what.
I've never had any luck with that.
Yeah, the other company was good, but I think Virgin's was more robust and more established than the other company was.
Any more questions or comments?
Never got anything for it.
Looks like the next meeting would be the 19th.
Oh, wait a minute, let's see. Yes, I think I'll be back that week, yeah.
Hopefully by then, we'll have a health officer and either a physician assistant or a nurse practitioner, one of the two.
Is there a motion to adjourn?
So moved.
Second?
Second.
All in favor? Opposed? Thank you, everyone.